So we'll go ahead and get started. As a note at the outset, we will have simultaneous English-Spanish interpretation for this panel. So if you're attending, please go to the bottom of your screen and select the globe icon to pick your preferred, click on the globe icon and select your preferred language. And just a reminder to the speakers, please remember to speak slowly and clearly so the interpreter can interpret. Thank you for joining us today. I'm David Benyon with Free Migration Project. Today we're going to be discussing the topic of medical deportation and talking about a report that we recently released in collaboration with the Penn Law Legislative Clinic about medical deportation in the United States. We will be broadcasting this panel live on YouTube, where it will be recorded. And I'll say that we will reserve some time at the end for questions and answers for folks who are attending. So I'm the Executive Director of Free Migration Project. We're a legal services and advocacy organization based in Philadelphia, Pennsylvania. Our mission is to advocate for freedom of movement of all people. And Free Migration Project represents immigrant clients in their legal proceedings. We work with coalition partners and grassroots groups on immigrant rights campaigns, like this campaign to end medical deportation. We engage in public education and outreach, litigate in the public interest, and we advocate for fair and open immigration laws. Before I introduce our panelists today, I want to explain just a little bit about what is medical deportation. A medical deportation occurs when a hospital pays a private company to physically remove an immigrant patient from the US to another country to avoid having to provide long-term medical care. And this practice can lead to the death or serious disability of a patient. We're holding this panel because we're working at Free Migration Project with a coalition of advocates, organizations, and community members to end this practice in the United States. We became involved in this advocacy effort last summer after we learned that a community member named AV, would use his initials to protect his identity, was about to be deported by Jefferson Torresdale Hospital in Philadelphia. He'd been involved in a motorcycle accident and was seriously injured and received emergency care, but then the hospital was threatening to send him to his country of origin to avoid having to pay his medical bills. So we were able to mobilize with community members, advocates, and AV's niece, Claudia Martinez, who's here as one of our panelists today, to stop AV's transportation by the medical transport company that the hospital had contracted with to fly him to Guatemala. After that, we continued to work with Claudia and with AV's advocacy team to locate long-term care for him and to build an effort to learn more about medical deportation, educate the public about the practice, and to start an advocacy campaign to end this practice in the United States. We were then able to connect to students at the University of Pennsylvania Law School's Legislative Clinic, including Erica Rodarte, who's here as one of our panelists today. And earlier this month, Free Migration Project collaborated with the Penn Legislative Clinic to release a report on the practice of medical deportation called Fatal Flights, Medical Deportation in the United States, which is available on our website, and we'll make the link available in a slide at the end of today's panel. I'll take a moment to introduce our panelists today before we start with questions for them. And first, we'll start with Erica Rodarte, who grew up in the El Paso, Ciudad Juarez border region. She is an incoming 3L law student at the University of Pennsylvania Law School. As part of UPenn's legislative clinic last semester, Erica was able to collaborate with Free Migration Project's campaign against medical deportation. While at Penn, she's also led pro bono and research projects on housing and immigration issues, two topics that she's passionate about and hopes to continue pursuing after graduation. And actually, we'll jump into questions for you, Erica, and then introduce the other panelists later. So regarding the Fatal Flights report that you helped prepare, what topics and information are included there? And what was your role in preparing this report?
Thank you, David, for the introduction and for grounding us on what medical deportation is. So the report is divided into three main sections. The first section was really a team effort of trying to learn more about medical deportation. First of all, what is it? We knew from AV's case here in Philadelphia what it looked like, but we wanted to know what it was more at the state and national level. We also wanted to know why it happened. Who were the key players in it, the doctors, hospitals, medical transportation companies. And then lastly, where else did it happen? Was this something that was just concentrated in the Philadelphia area, or like we learned, was this more of a national issue? My role, along with my fellow student, Jackie Manat, at the legislative clinic, was to conduct a lot of the research, legal research, but also on the ground research with advocates who have been working with medical deportation or healthcare and immigration issues, just getting to know as much as we could about the practice. And then as a second step of the report, trying to formulate with advocates and with the help of the FMP team, advocacy avenues to end the practice of medical deportation. And then the third section of the project, FMP was really instrumental in forming a toolkit. And this toolkit is meant for patients, their families, and their advocates in if it ever is the case that they face a potential medical deportation. So trying to put together a press release to do media coverage, trying to see how to identify a potential medical deportation. So those were the three main areas, and I'm sure we'll jump into them a little bit more.
And a couple of follow-up questions for you, Erica. To the extent that you've not covered them already, why does medical deportation occur, and how prevalent is the practice?
So what we learned through our research was that, well, first of all, undocumented immigrants lack healthcare coverage. And so when an undocumented immigrant ends up in the ER, let's say that they have a fatal accident, like the case of AV, they end up in the ER. Current law only, I guess, forces the hospital to treat and stabilize patients who have a medical emergency. If they're uninsured, they may be reimbursed through emergency Medicaid, but they only have to stabilize the patient. And then after that, there's nothing more that they have to do. And And so if a patient needs more or long-term care, the hospital is not willing to foot that bill, and they don't have to. There's also, nobody really regulates this practice. So that's a reason why it keeps happening. Nobody regulates it. There's a lot of barriers with patients. Sometimes there's language barriers to them understanding their rights. But we found various different things that led to the practice. We really couldn't put a number on how many cases happen every year because it is unreported, because there are so many obstacles to report, or the issue isn't just known about. A lot of the advocates we spoke to in the healthcare and immigration field, we weren't surprised by the end when we were the first ones to tell them about the issue. So a 2012 report done by Seton Hall Law School found more than 800 cases of attempted or successful medical deportations in just 6 years. But we really know that this is a very low number, and a number that has not been updated ever since.
Thank you, Erica. Next, we'll turn to Claudia Martinez, who has lived in Philadelphia for the past few years, and as we mentioned, is FMP's client's AV's niece and advocate. Claudia is a Christian, a cleaning service worker, and an entrepreneur with big dreams. She's also a member of the International Chaplains of America. Claudia, thank you for joining us today. And to start, I'd like to ask you to share a bit more with our attendees about how you got involved in advocacy to end medical deportation. What happened to your uncle? And what do you believe would have happened to him had the hospital been able to successfully deport him?
Hola David, muchas gracias por poder compartir un poco de mi historia y de lo que he vivido juntamente con mi tío. Pues desde el 24 de junio del 2020, el año pasado, yo ingresé a este grupo de defensores cuando nos estuvimos juntamente en el hospital de Jefferson Torresdale, donde detuvimos la deportación de mi tío, ya que el 10 de mayo del mismo año, él tuvo un accidente en la calle de Roosevelt Boulevard mientras él intentaba cruzar la calle. Una motocicleta lo atropelló, le dejó heridas muy graves, permaneció 15 días en coma en el hospital y fue ahí donde el hospital se movilizó para tratar de deportarlo. Y pues primeramente, gracias a Dios, gracias a Laila, que fue la persona con la que yo hablé primeramente, y ella se movió a buscar todo el apoyo de ustedes. Sé que hubieron muchas personas involucradas, un grupo de estudiantes también, y pues ahí se hizo una lucha muy fuerte y desde que empezamos yo dije que había que trabajar duro para poder detener esto. Yo no sabía que podía haber un apoyo, yo no sabía que esto era ilegal en ese entonces, hasta que los conocí a todos ustedes que han estado luchando juntamente conmigo. Y pues lo que hubiera pasado si hubieran deportado a mi tío como el hospital lo quería hacer, es que él hubiera muerto, porque ese mismo día, 24 de junio, cuando nos presentamos allá, él estaba inconsciente todavía, él no estaba en condiciones ni siquiera de moverse. Las personas que estuvieron allá conmigo presentes se dieron cuenta. Entonces, era algo totalmente fatal y pues quiero compartir de que vale mucho el esfuerzo que se ha hecho. Y es muy importante todo lo que se ha hecho hasta el momento, porque sí, efectivamente, esto es algo que la ciudad debe de saber, de que hay maneras de cómo prevenir esto. Y si no se da a conocer, nadie va a saber. Y pues yo sé que hay muchos casos que pueden seguir pasando. Y sí, efectivamente, mi tío no estuviera ahora mismo vivo de no haber detenido esta mala práctica.
Thank you, Claudia. Next, we'll turn to Mary Pat Palegi, who joined Community Legal Services in 2007 in Philadelphia as an attorney in the Health and Independence Unit. Mary Pat works with clients to resolve legal problems that arise in many different government benefit programs run by the Pennsylvania Department of Human Services and the Social Security Administration, and advocates for policy and systems improvements to make government benefits programs more accessible. Thank you for joining us today, Mary Pat. I want to start by asking, how is the issue of access to insurance related to the practice of medical deportation? And then, well, let's start with that and then I'll have a follow-up.
Okay. Yeah, so healthcare is really expensive, and the only way any of us are able to pay for it is through health insurance for the most part. And so even though in these types of cases where medical deportations are attempted, people's lives are often on the line. The prospect from the hospital's perspective of the financial loss of having unpaid medical bills seem to grow so large in the hospital or the medical providers from their perspective, that potential financial loss seems to be the motivating factor here for these attempted medical deportations. So in every case that I have seen, hospitals have attempted medical deportations when a patient is so sick or so injured that they need long-term skilled nursing care, but they don't have the health insurance to pay for it. And so the patient is stuck. They need to leave the hospital because they no longer need the type of medical care that the hospital can provide. But they can't move to the skilled nursing or rehabilitation facility that they need to go to because they don't have the health insurance in place to pay for it. The hospital also seems to feel stuck. And when they have a patient in this situation, hospitals, what has happened in the past, what happened in this case, and what has happened in other cases, is hospitals feel like their only option is to discharge the patient through a medical deportation. They have financial incentives to move patients out of hospitals as soon as, like Erica said, folks have been stabilized and their obligation to treat the initial emergency is complete. The hospital has a financial incentive to that and that point to find a safe place to discharge the patient. And so for these people with no other options, no other health insurance options, what we see, unfortunately, is that hospitals attempt to, instead of finding a safe discharge option here where the patient lives, they attempt the unsafe option of a medical deportation without that insurance in place.
Thank you, Mary Pat. As a follow-up question, here in Pennsylvania, do undocumented people have access to publicly funded health care, and in what situations might that apply?
Yeah, so really the only publicly funded healthcare option for anyone, immigrant or not immigrant, US citizen or non-US citizen, for long-term care, for the type of long-term care that patients in these medical deportation situations often need. The only publicly funded option is Medicaid. And Medicaid is really hard for anybody to get. There are very low income limits, really strict verification requirements. And then of course, if you are undocumented, it becomes very, very difficult to access Medicaid to pay for long-term care. And the reason that it becomes so difficult is because for undocumented folks, they can only access Medicaid if they have an emergency medical condition. We usually refer to this as emergency Medicaid. And emergency Medicaid is really tough to get. In large part, it's really tough to get because we have very little guidance, very little written policy about what an emergency medical condition is, what kind of treatment emergency Medicaid can pay for. And so without those written rules and written policies, a lot of those choices just come down to the discretion of individual policymakers. And that can be really problematic. Leads to some inconsistent decisions. And the immigrant communities and medical providers have a really hard time understanding the program and understanding who is eligible and who is not, because there's nothing out there for folks to look at in terms of rules or guidance.
Thank you, Mary Pat. We'll shift back to Erica for our next question relating to the report that you helped write. What are some of the advocacy options that you explored for preventing medical deportation?
Thank you, David. I think the very first one that we explored, and it's the most direct solution to the issue of medical deportation, is universal healthcare coverage, but not just any universal healthcare coverage. We'd be advocating for one that covers everybody, regardless of a person's immigration status. That way there wouldn't be the incentive for hospitals to even consider medical deportation because they wouldn't be footing any bills. Everybody would be covered. More on the regulation end, though, we also explored at the federal and state level steps that we could take with different agencies to advocate for more informed consent. So when a patient is going to be discharged, making sure that the patient understands their rights and understands the consequences of their transport if they are medically deported. Also reporting resources. If a patient is about to be discharged and themselves or their family members is able to report to a local, a state, or federal office of medical deportation, having those numbers is really helpful, especially because it's hard to put a number to medical deportation right now. And that just makes it harder to even advocate against it. We also explored how we could put together a directory of advocates working on the issue to increase the advocacy. And then lastly, just really pushing on informing patients on the health and immigration consequences of medical deportation. I think Mary Pat's going to cover this a lot more later on, but also increasing emergency Medicaid for long-term care. And then at the local level, exploring what cities like Philadelphia could do to denounce the practice and to look into sanctioning hospitals who do engage in the practice.
Thank you, Erica. For Claudia, my next question is, what do you hope might happen as a result of the report that we released recently, which you contributed to, and this campaign that you've been involved with?
Gracias, David. Lo que espero es que no sigan pasando este tipo de casos, que puedan ponerle un alto a los hospitales que hagan esa práctica y pues también que todas las comunidades de Estados Unidos puedan enterarse de que hay apoyo y hay formas, maneras de lograr hacer que esto se detenga. Y también que todos puedan entender de que es muy importante, tanto en la familia como en algún conocido, saber cuáles son los pasos a seguir y qué se debe de hacer en caso que suceda, porque es muy importante detener con esto que nos siga sucediendo. Y ese es mi mayor deseo, que nadie más o ninguna otra familia pase lo que yo pasé y toda mi familia por el caso de mi tío.
Thank you, Claudia. For Mary Pat, to follow up on your earlier comments, is there anything else that immigrant communities and advocates should understand about how emergency Medicaid works in Pennsylvania? And then, I mean, we're just one among 50 states. What about other states? And I know that your office has been advocating around improvements to the process for accessing emergency Medicaid, particularly for undocumented immigrants. And maybe could you talk a little bit about that as well?
Yeah, so I think it's really important for folks to understand that emergency Medicaid is available for long-term care, at least in this state. I said earlier that it's not easy. It's not easy for anyone to get long-term care Medicaid. And it is more difficult for undocumented immigrants to get long-term care Medicaid, but it is possible. It requires the participation of medical providers. And so I think hospitals have a big obligation here to educate themselves about emergency Medicaid and about the process for applying for it. I think that was a big reason why Claudia's uncle found himself in this situation to begin with, because the hospital didn't fulfill that obligation. So it's really important for medical providers, and especially in this particular group of cases for hospitals, to understand that emergency Medicaid is available for long-term care in Pennsylvania. So emergency Medicaid is a federal program. It uses federal dollars to pay for it. But there are also ways that state governments can use state funds to pay for the long-term care coverage that immigrants might need. And Erica and Jackie did a wonderful job in the report, through their research for the report, reaching out to some of those some other states that are doing this. Washington State is an example of a state that is using some of its own state money to provide long-term care coverage for immigrants in that state. And that is certainly something that could happen here. We do have a small state-funded medical assistance program in Pennsylvania, but even that, unfortunately, is not available to undocumented immigrants, as an example. So certainly there could be some more work that we could do here in this state to expand state-funded coverage. And then for the federal program that we have in Pennsylvania, the work that we are doing at Community Legal Services now is work to get those written guidelines, those written policies in place, so that when a hospital is thinking through their next steps with someone who they might be thinking about a medical deportation, if that hospital, that's the staff at that hospital, can look online for the Department of Human Services policies on emergency Medicaid and see written in black and white that emergency Medicaid is potentially available for long-term care, then I think that we could prevent a lot of these attempted medical deportations from happening.
Thank you, Mary Pat. As a follow-up, I guess, if the funding is potentially there from the federal government, why do more states not make it available for this purpose? What are some of the obstacles to that happening?
There is, like I said before, there is very little guidance out there from the state government and also from the federal government. So the federal government has said very little about what it considers to be an emergency medical condition, and leaves a lot of these decisions up to the discretion of each individual state. So in states with Medicaid programs being led by people who, for various ideological reasons, might want to make Medicaid more difficult for immigrants to get, this would be one way to do that, right? Is just to restrict access to emergency Medicaid, interpret the definition of emergency medical condition as tightly and as most restrictively as they can. I think that happens in some states. Not being in other states, I can't think of all the reasons why this might not happen. But certainly, if we, one potential advocacy strategy here could be to get with the federal government and ask them to make it clearer to the states that things like long-term care, for example, can be covered under the federal emergency Medicaid program, so that more states that want to do it can.
Thanks. And I have a follow-up question for for Mary Pat and for Claudia, and maybe we'll go to Mary Pat first. But what you mentioned that despite there being funds available for Jefferson Torresdale Hospital to potentially pay for the care they were providing to AAV, what was the breakdown in this particular case? Why did that not happen?
So immigrant eligibility for Medicaid is extremely complex, and the rules are widely misunderstood. And I think that's what happened here. There was a misunderstanding about immigrant eligibility for this Medicaid program. And again, because there is no clear policy in place that would clearly tell this hospital that emergency Medicaid was available in this instance, it took a while to convince Jefferson Torresdale that this was a possibility for Claudia's uncle. And I think it basically came down to a misunderstanding about immigrant eligibility for long-term care emergency Medicaid.
And I guess I'll reframe that question a little bit to Claudia. Well, I should say, did Jefferson Torresdale Hospital, in their conversations with you as the family member point of communication for your uncle, did they ever talk about the option of how to pay for care? And why do you think that they didn't end up actually pursuing an option of Medicaid funding to pay for your uncle's care?
No, voy a ser muy sincera, y ellos en ningún momento dieron ninguna opción. Incluso ya cuando Laila estaba ayudándome a hablar con ellos, en ningún momento ellos ofrecieron alguna opción ni nada. Ellos actuaron como muy rápido, cuando incluso yo recibí amenazas por parte de ellos diciéndome de que lo iban a mandar para Guatemala y lo iban a mandar. Y así en la condición que él estaba. Yo traté de hablar algunas veces, como insistir de que no lo podían sacar de esa forma porque tuve oportunidad de verlo. Incluso él no me reconocía a mí porque, como había mencionado anteriormente, estaba él en coma y estaba con muchas heridas, incluso tuvo algunas operaciones en su cuerpo, bueno, fueron varias. Y yo, a cómo lo miraba a él, yo traté de hablar con el hospital, pero incluso no fui escuchada. Entonces, yo tengo que ser sincera y creo que eso fue lo que pasó. En ningún momento ellos trataron como de dar una solución.
And Claudia, I want to ask you if you're comfortable sharing any information about what is your uncle's current condition. You talked about what you think might have happened to him had he been sent back to Guatemala. How is he doing now?
Gracias a Dios y a todo el apoyo de ustedes, mi tío ahora puedo decir que está muy bien porque él está recuperándose, está incluso recibiendo terapias, tiene el cuidado necesario. Yo también tengo ahora las oportunidades de irlo a ver y lo está oyendo a ver. Está muy feliz porque ahora está entendiendo de que va mejorando día con día. La verdad que siempre digo lo mismo, estoy muy agradecida a todo el esfuerzo que ustedes han hecho. Sé que no ha sido fácil, pero ustedes son un gran equipo y, y bueno, en nombre de él también y de toda mi familia, yo les agradezco mucho todo el esfuerzo.
Thank you, Claudia, and thanks to the other advocates, including Mary Pat, who's worked to support AV in his effort. And in case it wasn't mentioned, without divulging too many details, I'll just note that AV was transferred out of the care of Jefferson Torresdale Hospital to another facility where he's been receiving the longer term care that he needed and continues to need. I guess before we go to our Q&A for attendees, I did want to ask, well, both to Erica, I'll turn to you first, and then to Mary Pat. Can you share in the course of your research or your work, what if you've come across one or two other examples of medical deportation that that you recall that struck you? Or that you've learned about, whether in Pennsylvania or elsewhere? Erica?
I think the other case that received media attention back in 2009 that really struck me was the medical deportation of patients who had been receiving dialysis at Grady Memorial Hospital. This is in Atlanta, Georgia. A few patients had been receiving their dialysis for quite some time here. The clinic unfortunately had to close down, and none of the patients, all of them were undocumented immigrants, so none of them were eligible for insurance. After explaining to them that they could be transported back to their home country, a few of them to Mexico, there was a lot of breakdown in communication. They were promised health insurance, Seguro Popular in Mexico, for about a month, dialysis. So they were promised a variety of things that may have led to them to consent to their transport, according to the media coverage. But ultimately, they get to Mexico, they're medically transported, and it turns out the dialysis that they need isn't covered. And the kidney transplants that these patients needed is not covered. So this became fatal for some of the patients. Some of the patients passed away as a result of their transport and as a result of not being able to afford even dialysis a few weeks being there in the country. So I think it's one of the examples that we know of that what did receive that media coverage. And the scary thing is how many more of those cases have happened that just don't get that US media coverage that we don't know about. And it was just very, one of the cases that stood out because it was people that lived in our communities, they thrived in our communities, that were getting the care here. And after a few months, it was just completely cut off.
Thank you, Erica. And I'll just note too, you're referring to cases that occurred in 2009 under the Obama administration. I believe the Seton Hall report from 2012 covered other cases during the first Obama term. And even though the attempted medical deportation last year here in Philly obviously occurred under the Trump administration, well, I'll ask Mary Pat what your experience has been, but it's my understanding that it's been a bipartisan phenomenon. It actually occurs outside of the orbit of immigration enforcement entirely. And so we don't anticipate that this practice is going to disappear under the Biden administration or any future Democratic, nominally pro-immigrant administration, because of the underlying fundamental conditions that result in the practice. But Mary Pat, would you be able to just reference briefly any other cases that you're aware of, whether in Pennsylvania or elsewhere?
Yeah, I think what I can say about the other cases that I know about here in Pennsylvania is that they were all about lack of insurance. And so who happened to be sitting in the White House has little to do with that, because people's access, or immigrant access to healthcare has not changed since 1996, when the Welfare Reform Act passed and created all of these new restrictions on immigrant access to Medicaid. In every case that I have heard about, there haven't been many, but in the few that I've been involved in Pennsylvania, they were fixed by CLS's ability to find a health insurance option for the patient. So I really do believe that expanding access to health insurance for immigrants will be a key piece to eliminating this problem altogether.
Thank you, Mary Pat. Before we go to Q&A, I want to make one comment about prevalence of the practice and why it's hard to measure. My guess is that for every case that comes to the public's attention, there might be 10, there might be 100 cases that we never hear about. Yeah. Because there are so many institutional factors that push these cases underground, behind the shadows. For instance, if a patient doesn't have a strong family advocate like Claudia, it could be that there's no one there to advocate or to tell anyone about what's going on. There's also a lot of pressure from a range of institutions that's sort of undergirded by the immigration enforcement system, where, for instance, there have been threats from medical transport companies to family members that they would contact ICE if the family doesn't cooperate in the medical deportation. And so we suspect that that pushes probably most, or factors like that push most cases under the radar. And since there's no reporting and no regulation of the practice, it's nearly impossible to get an accurate count of the total. We did speak to a scholar who's written about this issue, Professor Sana Liu, who mentioned that one hospital that she's aware of closer to the border, her best estimate is that 100 medical deportations each year happen there, and that there are other hospitals around the country that are also bad offenders. We suspect that the total number may reach the thousands per year, but again, it's almost impossible to know for sure. So with that, I did want to open it up to some audience questions and answers. And we'll go, there's already a few in the Q&A. Please write your questions in the Q&A. If you click on the Q&A icon at the bottom of your screen, you can type in your question, which will refer to the panelists to answer. If you're comfortable including your any organizational affiliation, please go ahead and put it into the question as well. And if you want to direct your question to a particular panelist, please go ahead and do that as well. So our first question comes from Carmen Guerrero, who asked where we could see the new laws with regard to medical deportation. And to be honest, I'm not sure, unless any of the panelists want to weigh in, maybe some of the introduction was unclear. I'm not aware of any new laws that would either regulate this practice or make it more likely. The situation still is pretty stable on the factors that lead to medical deportation. Is that in line with what the panelists understand? And I'll go to the second question from Carmen, which is, I'm sorry, I'm switching modes to Spanish, which isn't as easy for me as for some folks. But basically, I think this is directed to Claudia, if something similar to what happened to your uncle were to happen to somebody else, how would advocates or the family find help to stop it from happening?
Pues primeramente acercarse a los grupos de ayuda, como por ejemplo a Pre-Immigration Project o abogados de familia, trabajadoras sociales del estado. Ahí uno encuentra apoyo. Ellos le abren puertas a uno, donde ellos mismos son, bueno, la principal piedra para apoyarle en algún caso de estos. Creo que confiadamente pueden ir directamente a estas organizaciones a que les ayuden. El problema de muchas veces es que tenemos miedo a hablar y no hablamos, no buscamos apoyo o ayuda. Entonces, tenemos que hablar, no tenemos que quedarnos callados cuando pase algo en la familia o en alguien que nosotros conozcamos.
Thank you, Claudia. I'll open that question to Erica or Mary Pat if you have any ideas to share as well. For who impacted community members and their families and advocates can reach out to for help if they hear that this threat is possible.
I think I would just add that the report with the different organizations that we talked to throughout our research, we tried to create this national directory where advocates actually opt in to talk to people who may be facing this at some point. So if you go to the report, one of the Appendix D actually has a growing list of advocates who you can reach out to, including Free Migration Project, that can be there to help you. And then I don't know if you want to talk about this a little bit more, David, but media can be make a very big difference in covering the issue as well.
Yeah, I would definitely agree with that, at least in the case of Claudia's uncle, the hospital was not pleased when two members of city council and a bunch of community members showed up on their doorstep, and then the cameras followed, and the advocacy team and Claudia held a press conference, and we feel that that had a big impact on the hospital's decisions. So sunlight is a good disinfectant for holding hospitals accountable in this situation. And I would also refer any folks in Philadelphia, obviously, to community legal services if they're having any problems accessing emergency Medicaid. To that point, and I'll direct this question to Mary Pat from Amaya Pavon. The question is, if a person has emergency MA, emergency Medicaid, can they use those funds for anything related to their health or only the condition they have?
Yeah, thanks for the question. And just to quickly follow up on what David just said, yes, community legal services is an option for folks either in this situation or having any trouble accessing emergency Medicaid. We're still doing phone intake. Unfortunately, our office is not yet open for in-person intake, so you can call us 215-981-3700 if you have folks who need to connect with us for help with Medicaid. For folks who already have emergency Medicaid, emergency Medicaid is Medicaid just to treat an emergency medical condition, not anything else. So in these cases, the key is identifying the emergency medical condition and then convincing the state that that long-term care treatment at a rehabilitation facility or at a nursing home is the care that's needed of that core emergency medical condition. So it's not just Medicaid that you can use for anything, unfortunately. It is just Medicaid to cover treatment of your emergency medical condition.
Thank you, Mary Pat. Yeah. We have one more question in the Q&A so far, and I will open this up to any of our panelists. The question again from Amaya Pavon. Is it possible that hospital staff needs more training regarding treating immigrant communities, especially those who may not be eligible for state benefits?
I think that is definitely a possibility, and I would say yes. Hospital staff, I have found over the last 14 years doing this work, could always use more training on healthcare options for all low-income people, but especially for immigrant communities. And so a big part of what we do at CLS is try to provide that training to hospital staff, but also to get the state government, which is really the government entity that has this responsibility to be sure that people can access the healthcare programs they're eligible for, to get the state to do some of that outreach as well, to be sure that everybody has that information. If folks on this webinar today have ideas about particular groups of medical providers or hospitals that could use that training and want it, I would be very interested in hearing about it and offering to do some of that training.
Thank you, Mary Pat. And could you, for our audience and for our recording, please share CLS's phone number once more?
Yes, sorry, as soon as I find the unmute button. So CLS's phone number for phone intake is 215-981-3700. And we're only doing phone intake for now, which means people call, they leave a voicemail, we give them a call back to talk with them about their case. We hope to be open for in-person intake again in the fall. So hopefully people won't have to rely on that number for too much longer. But the number one more time is 215-981-3700.
Thank you, Mary Pat. Thank you, Erica and Claudia. We're nearly at our hour. So we did want to share some links to additional information, and wanted to say thank you to our audience and to anyone viewing on the YouTube station. Thank you for joining us today to learn more about this important issue. Please click on or check these links to find the report. We would love it if you would share the report through your networks. It's called Fatal Flights, Medical Deportation in the United States. We also have a survey that we're conducting to try to gather more information about the practice and about public awareness of medical deportation. So you could help with this effort by completing and sharing the survey, and the link is there as well, and we'll have it on our website. Feel free also to sign up for Free Migration Project's email list and to follow us on social media. Wanted to say thank you to our panelists and to our interpreter, Lena, and to everyone. Please stay safe and have a great day. Thank you.